As the need for cancer care continues to grow, implementing strategic ways to increase access to innovative cancer care close to home is increasingly a pressing need. FirstHealth of the Carolinas has been on a mission to make that happen in their own community in Pinehurst, North Carolina. I'm Kelly Simpson, a director at the Chartis Group and specifically a practice leader in the Chartis Oncology Solutions practice. I'm talking today with Dr. Daniel Barnes, who's the president of the FirstHealth Physicians Group. Thanks for joining, Dr. Barnes. It's good to see you again.
Good to see you. Glad to be taking part in this. Thank you.
Great. So you'll be offering innovative leading practice cancer care at the new center. What are some of the features and how did you identify the essential elements for your cancer service line?
At FirstHealth, we have outstanding oncology physicians and great support care services, but they're geographically separated, and that creates some fragmentation from the patient perspective. We feel that bringing all of the services under one roof will be able to improve the efficiency of our staff and our providers, really create a better patient experience. And through that, we will also have an increased ability to offer multidisciplinary care by having providers as well as support care in the same building.
And so you just finalized your architectural plans, which is exciting for the new cancer center. Congratulations as you begin construction on the new center. Can you talk a bit about why it was so important to have the Comprehensive Cancer Center in Pinehurst in central North Carolina?
You know, we really found that we had a number of patients leaving our community, and through some of the work we did with Chartis, identified an overall loss in market share. And as we really try to identify reasons why, not having a comprehensive cancer center owned community, we feel is one of those reasons. So really being able to offer all of our services together, being able to allow patients to stay in the community, we feel is a huge benefit to all of our patients.
Yeah, and part of your ability to invest in these innovative services and in the new center itself is really a result of your tremendous financial success and performance. So I wondered if you could talk a bit about your journey in planning for the cancer center and how you determined what you needed, how you raised the funds for that, and planned accordingly.
Our journey really started 8 years ago. We went to visit a couple of comprehensive cancer centers in the state of North Carolina, and that's when we really identified the opportunity that we had to be able to bring all of our services together. 5 years ago, we conducted a feasibility study through the foundation of FirstHealth. And through that study, we estimated that we could raise $30 million in philanthropy toward a comprehensive cancer center. And our foundation is actually committed to that amount of money as we go ahead and begin the process of beginning construction on this building.
Wow, that's a great goal to have. And I know you have tremendous support in your community for that. So I don't doubt that you can meet your goals there.
I think that we will. Obviously, COVID has created some challenges with getting people together, but we've really found innovative ways, really through a number of short videos where we've been able to highlight some of our specialists, our physicians, as well as really been able to get a message out there on why this is so important to us and really what we're trying to offer.
Yeah. Oh, that's pretty creative way to attack it during the COVID days here. Interesting take on that. So, you know, many providers that we work with focus on the treatment journey post-diagnosis, honestly. But FirstHealth is taking a very unique longitudinal approach to care, which we're encouraging folks to do more and more, that begins with education, prevention, screening, and wellness. Could you describe what's different and distinct about this approach and how it'll benefit the communities you serve?
I'd be happy to. We've been working with our community partners, all those different clinics and physicians that participate in cancer care. And the first thing we've really tried to do is help establish the same guidelines. So there's multiple different screening guidelines out there. We want to send the same unified message to the community as far as screening goes. FirstHealth has been very clear in this, that we are not after increasing our ancillary revenue. We don't care where a patient gets screened, just that we are increasing the amount of screening that is happening in our community. We feel that through really community education and highlighting the services that we offer at FirstHealth, we will be able to increase screening, and with that, hopefully diagnose more people at an earlier stage of cancer and really be able to offer them a cure with their treatment.
Sure, absolutely. So both as you begin construction and then into the future, after the doors are open, what are your goals for cancer care in the long term?
Our goals are to develop a patient-centric cancer care delivery model that creates the ultimate patient experience. We want to make sure that what we are doing, we're bringing services to the patient, not having the patient go from space to space. We are also really updating to make sure we have the latest technology from linear accelerators and software to go with that, as well as really enhancing our clinical trials. By having clinical trials in the same building, we feel that we'll be able to enroll additional patients into some of the latest cutting edge treatment that is out there. We've been first in the country and first in the world on multiple clinical trials over the last 2 years. We see that just continuing to grow, and with the ultimate goal that we can offer everything that an academic center does right here in their own community.
Wonderful. I know one of the unique things about how you've developed along the way is that you've had incredible participation from your medical staff and from the various specialists. And it really spans starting with primary care and internists all the way through. And part of that process has also been the development of disease-specific programs. I wonder if you could touch on, your experience with that inclusion from the very start, not only with your providers, but with community members and board members throughout the planning stages into where you are now.
Yeah, I'd be happy to. So 3 years ago, so March of 2018, we formed a cancer center steering committee. And on that committee, we included physicians that treat cancer patients, primary care, board members, as well as our executive team, to really get a nice cross-section of all the various partners that are involved in cancer care and the support of our services. And that group really helped form the vision of what we were trying to create. But at the same time, it allowed us to really create excitement and engagement with our physician partners, as well as the executive team and the board. So I think that committee in itself really helped us really kind of jumpstart that journey. There is true excitement across the board. Through the design phase of our cancer center, again, in the middle of a pandemic, when not being able to gather in groups in person, we had over 60 staff involved in the design sessions every other week for a period of 3 months.
Wow.
And we had 20 physicians and other providers that also participated in that process. So independent practitioners taking time out of their schedule to be able to participate in planning meetings, I think was really a testament to really that the entire community wants this, and they want this cancer center as soon as we can possibly deliver it.
Yeah. Have you had much direct patient participation in the process or in the design?
We sure have. So especially on the infusion unit itself, we did a survey of 90 patients that were either current or former patients in infusion to really get their opinion on, would they prefer more private rooms, semi-private infusion suites, or more of an open design. What was interesting is that there was an even split. So based on that, we incorporated that into our infusion center so that there's private rooms that have private bathrooms, there are semi-private, but then overlooking the healing gardens in this building are open bays. So we're able to increase the number of chairs that we have, but really kind of cater to what the patients desire. And that may depend on the day, depend how they're feeling, whether they want to be able to sit and have conversations with someone receiving treatment versus if they want to be more by themselves.
Sure. What's the governance and operational model, and structure that you've established to really oversee the entirety of the service line, recognizing that the cancer center is one portion of that overall service?
Yeah, so we have worked to implement a dyad model with an administrative director of our oncology services with a medical director, and we're currently developing that service line, and we've reached out to folks, again, a little bit delayed due to some of the things we're dealing with COVID-19, but we have representatives for each different section of physicians that participate in cancer care to have a true dedicated service line that has broad representation across the organization.
Okay. One other thing that I know that you focused on very much, even during the planning stages, is capitalizing on those opportunities that you had operationally. And
Yes.
so one area of focus I know was the hematology oncology practice and access to care, getting new patient appointments, streamlining that whole process. And I wonder if you could share some of your experiences there and some of the results of that work.
I'd be happy to, and I think that's where we probably made the most gains over the last few years. So we sat down and we met with our oncology physicians because one of the reasons that we felt that we were losing market share was based off of an almost a 2-week wait for a new oncology appointment. Anyone that's been given that diagnosis wants to be seen, and they want to be seen as quickly as possible. So actually working with your group, with Chartis, we sat down with physicians and really asked what were the barriers, what was preventing us from being able to decrease that wait time. And we came up with really a number of things that we implemented along the way. First was space. We didn't have any space to be able to add additional providers. Even though we're planning and designing a cancer center that we're going to move into later, we added 5,000 square feet onto the existing center so that we could have additional room for providers and nursing staff to be able to increase our overall volume. The other thing that we found from the providers is they felt that there were some key positions missing in our overall operations. So a port nurse, a triage nurse, scribes, and additional CMAs. They felt that if we could bring those on board and implement those kind of changes, that they would be more efficient. And then finally, what we really worked on was the care team model, bringing in additional APPs into our clinic and having a physician, an APP, an RN, and a CMA as a care team. With that, we were really able to have new hematology appointments be seen by the APP, the nurse practitioner, as well as follow-up oncology appointments. What that did was it freed up many additional new oncology appointments on a daily basis, and that has decreased our wait time. So we went from not quite about 12 days down to 6 days on average over the course of the last year. That has also had a direct increase in our overall revenue and our contribution margin. So those are the things. And I think that once we delivered those, we listened to the docs, we put those things in action, and we truly delivered on everything we said we were, that we were going to. We found that the engagement and the excitement from the physicians really increased, and that's what drove this. The fact that the physicians have been focused on new appointment times and really working with us has made a huge impact.
That's great to hear. So glad we could be part of it, but certainly you've taken the reins and gotten some real performance improvement there. Well, Dr. Barnes, unless you have any other thoughts, I wanted to take the time to thank you for sharing your experience and what FirstHealth is doing and your success in making cancer care more accessible and cutting edge right there in your own community.
Well, thank you, Kelly. We appreciate the partnership that we've had with Chartis and appreciate the opportunity to be able to speak with you today.
Thank you.
You're welcome.